Yeah. So here there was a pregnant female. G2P1 means gravida 2 and era 1. So yeah, basically there is a pregnant female who has this. She has bouts of sweating and dizziness lasting for a few minutes laying down on bed. Symptoms resolve when she rolls on the other side. Means when she's sleeping, there is some sort of problems arising. Her blood pressure while sleeping is 90 to 50, 90 by 50. But when she rolls on one side, her pressure increases to 120. Immediately it increases to 120. No, slowly increases to 120, and this is it. What describes the best? What best describes the mechanism? They're asking this, okay? So yeah, one of the things we can think about is she's pregnant, right? She's having a gravid uterus, a big uterus filling up her belly. So when she's sleeping, the vena cava lies in the back. Even aorta lies in the back, but aorta is safe. But vena cava can get compressed, right? It can get compressed. Even aorta gets compressed. So usually we think of as the possible simplest answer as possible. Like, whenever you are stuck with so many options which you think can be right, go one by one. Like, can aortocaval compression occur in this female? If yes, of course it can occur, right? If yes, then can aortocaval compression cause this thing to occur, that blood pressure goes down or it goes up? Yes. So yes, the answer is that don't go to another option at all. If you are 100% sure that yes, this can occur and this can cause this, then that's the answer. This is the strategy you should go in USMLE, because trust me, in USMLE step 1, each and every option will seem right on your exam. Like 90% of cases, all the options will be right. But you should move on to the most possible option. So clearly the answer is aortocaval compression. Now progesterone surge. Why is there sudden progesterone surge? As she told that this, how many she's saying, lasting a few minutes. She hasn't said that this occurred suddenly or this has occurred from long time. So progesterone surge doesn't occur suddenly. Okay, during the pregnancy, the progesterone levels remain the same, one and the same, right? There is no menstrual cycle going on. So B can't be the answer. And progesterone surge doesn't cause this thing. Sudden progesterone surge can cause vasodilation, yes, but on laying on one side, progesterone surge doesn't go away, right? So this thing won't occur. Blood pressure won't come back to normal. Increasing plasma volume, that is a normal in pregnancy. That is a normal sign of pregnancy, but that doesn't explain low BP. In fact, plasma volume increase, so increase in blood pressure should have been seen. So peripheral vasodilation, yes, it can cause, but that doesn't explain the increase in blood pressure on lying to one side, because vasodilation doesn't lead to vasoconstriction when you go on to one side. RAS system again doesn't explain this thing. And RAS system is rather responsible for increase in BP, right? Not decrease in BP. So clearly the answer is option A.
Thanks for watching. Please give a thumbs up and subscribe for more.